go ahead and call the meeting to order. Everyone please rise to the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you guys for braving the weather to come out. First, it's a roll call. Let the minutes reflect all 5 members are present. Next is approval of the agenda. Questions or questions? Is there a second? Thank you. Second by Heather. All in favor? Aye. Motion passes 5-0. Next is informational items. The first is other.
As everyone's aware, we had an early dismissal today, and it's something I really tried to avoid. Wasn't sure about when the snow was going to start. There was the weather forecast as early as this morning were inconsistent on when it would start, but they were all fairly consistent that it would be snowing at our regular dismissal time. So worked with Chris closely and spoke with some other areas superintendents, and we made a decision to dismiss a little bit early today. I was at both our schools during that dismissal and spoke to the principals and front office staff, and they were all positive. I think it went about as smoothly as an early dismissal can go. Of course, as soon as that call goes out, some parents start picking their kids up from school. Of course, we allowed that, and that did affect our attendance a little bit today because we had a lot of kids getting picked up before lunch. But it went about as smoothly as it could go. I've already called for an NTI day tomorrow. The reason for that is just a combination of the temperature and the fact that what is on the roads now is not going to go anywhere. And I'm not sure that salt and brine on the road will do a lot for us at this point. I think some other districts have already closed for tomorrow as well. I know that Boone and Kenton have both closed. So it's just a fact of life this time of year. A piece of positive news. Sarah Hester shared ACT results from the December administration of ACT, and I don't know how long Sarah has been a counselor at our high school. Her comment to me was it's the largest increase in ACT scores that she has seen since she's been a counselor at the high school. So I'm sure that Mr. Nash will share that data with you in our regular meeting later this month. That's a piece of very positive news that I was elated to hear. So that's all I have this time.
Anyone else?
So with the NTI, doing the NTI, what are we doing? Because we're doing synchronous learning at the middle school
Yes.
and high school, correct?
Yes.
So what are we doing for the folks that don't have, they still don't have everybody on high speed as part of a meeting I was on this morning. What are those kids doing that don't have?
It was my understanding that everybody had high speed.
That's not my understanding. We walk around the road.
Jason, do you have any information on that?
No, I know that there's always some houses that do not have access, and we work with the Frisky to identify those households and provide some kind of solution. And then teachers at each school should also provide an alternative learning plan for the students.
You say Walker Road? Okay.
That stretch there by the vineyards is not doing.
Okay. I thought they did address. Okay.
I know, they had a county account, like there was a meeting this morning with the realtors and all the drug executives, and they talked about, but by 2023, everybody will have it, but
Do we know how many homes have students in them?
I don't.
Okay.
I was reached out and asked, if we can, what we can do about it.
Our Chris personnel had literally a list of kids and homes and addresses that needed support, and like Jason referred to, we worked with some community partners to address those issues.
It's not about the financials, it's about the availability.
Right. Okay. I'll look into that tomorrow.
Okay.
Thank you. Okay, audience of citizens, we have one, Ed Siegel. Speak to the mask. Yep, just you. Well, there's only 2 of you, so. 50% is pretty good.
I'd like to start by saying it's great to see some of your faces today. So thanks for the opportunity to speak. I'll keep it short. I have 3 boys attending Walton Road, a sophomore, a freshman, and a first year. And as Dr. Baker and this board knows, I've written to them and the Kentucky Board of Education several times since the beginning of the school year. And I attended a meeting back in September expressing why my family's concerns for the mandates of masks, of course. In my letters, I shared several sources of data from the CDC, the FDA, medical doctors, and other professional sources, all of which provide factual data on the known risks and ineffectiveness of masks. Of course, there are just as many sources from the CDC, FDA, and other medical doctors and other professional sources that provide data stating that masks are effective, with a few caveats, that the effectiveness depends on the type of mask, whether it's cloth or medical grade, and if it's used according to very specific guidelines. For every one doctor or expert on one side, you're going to find a doctor or expert on the other side. So where lies the truth? Where are the definitive facts to prove one over the other? Truth is, there are none. So even so, some might argue that it's still worth wearing a mask to avoid a potential risk of spreading the virus. A virus that has 99.76% recovery rate based on today's, as of today, I checked it, 7-day average. Others will say, including myself, it's not worth it. There's only one definitive fact in all of this. Not anyone in this room, not Dr. Fauci, not the CDC, the FDA, or anyone else can tell you the definitive facts on the long-term impact of our children having to wear masks. The long-term impacts on the physical, mental, and emotional health are absolutely unknown. I can say from my own experience that the mental and emotional impacts that I've witnessed personally from the past 2 years, especially in young children, is heartbreaking. I pray that the damages are reversed. Masks should be optional, period. Parents should decide what's best for their children. I shared a quote from Andy Beshear, the governor, when I spoke last time in September. I do feel it's important to share it again tonight. Governor Beshear expressed his frustration with another school board here in Kentucky that chose to allow parents to make decisions for the health and safety of their kids. Governor Beshear stated that, quote, anyone who is making these decisions are facing a huge personal liability in the future. Once they make a decision that is against, and he emphasized here, all science, that is against all evidence, that is against all advice, and somebody gets hurt, they ought to expect to pay, one way or another. I agree with Governor Beshear. What the governor said is true. However, the word all includes all. It's not selective. Thank you.
Thank you. Next, we're going to move into the recommended board motions. First is the approval of the minutes.
I'll make it.
Discussion or questions? Is there a second? Second by Stacy. All in favor?
Aye.
Motion passes 5-0. Next, the approval of the parameters to determine mask requirements. First by Heather. Discussion, questions?
So my only thing is, just looking at the recommendation in front of us, is do we really want one to go that low? And should it be an and, or really should it be an or situation? Because I think once we get that low, we have the possibility of getting even lower to like the 86, and I just think maybe 90% might be too low.
Well, if I could add, the data that I shared with you all,
Yeah.
it was yesterday, was up through yesterday. Let me add today's data to that.
Okay.
Today, our student-wide attendance was 91.68%. That is 2.5% lower than it was yesterday. But a part of that issue is we had a lot of kids picked up once I announced their early dismissal.
I'm sorry, can you repeat that? 91.6?
91.68.
Thank you.
Our staff attendance today was 90.83%. So our staff attendance has improved every day this week. Tuesday was 88.75, Wednesday it was 89.17, today it was 90.83. So just to provide that context.
Do you have a number of the staff?
We have 240 employees, so if we're at 90%, that means we have 24 staff members out.
But 4 or 5 of those are permanent, or not permanent, but maternity leave and that.
We currently have 3 on maternity leave and 1 on long-term medical leave.
4.
Yeah. But again, and this is my recommendation, it's a board decision, my recommendation, we keep this as simple as we can. My advice is not to get into splitting hairs on why somebody's out, because that is hard to get down at times. Somebody may be sick, and they're not coming in, and we don't know if it's flu, if it's COVID, if it's strep, if it's, you know. So my preference would be to keep this as simple as we can, whatever you want to decide. But again, whatever the board decides, we will carry out. Kent is a little more vague. Henry released a letter last night that just said they're monitoring average daily attendance, they're monitoring infection rates, they're monitoring, infection rates in their county as well as in their district. They're monitoring their test to stay data. They're monitoring a lot of different factors there, but they don't have a metric like we're discussing tonight that the board has approved that will automatically trigger going back to masks or will automatically trigger a long-term NTI situation. Henry has a little bit of latitude there with that situation.
What's Grant doing?
Grant is not in, masks are optional, and I spoke to Matt Grant at the superintendent's conference in December, and he was skeptical that, and his board voted on this, he was skeptical that his board would ever vote to make masks required again. Now, things can change, but that's what I was told in December.
I believe they're at, they have to be above 80, I hate to say, 87 or 88% attendance, because that's their normal, if they go below it. I believe, this was talking to the principal the other day, and if they go below that, then they go back into masks until the attendance rate reaches above that, which I think was 88%, for 2 consecutive days. So if they're down, they stay in them, if that's a week, until they hit an 88, 2 consecutive days, and they come back out.
So I was wondering, what is our discussion about, like, what is going to trigger going back to option? My question is, we're discussing the metric of triggering a mask on, but I was also wondering what the end point is.
I mean, this says for 1 month, that's a long time. So if we go into it next week, then you're essentially in them until February. And then if you have a couple days and you're back in them till,
And I think everybody would agree. If the decision is made, or if we approve a metric tonight and it triggers a mask requirement, there's going to be pushback on it. I think everybody would agree with that. What I would really like to avoid is being, I'll use this, as being on a yo-yo, or inward out or inward out. And that was a part of the reason I chose 1 month. Another reason is, I think if things get so bad that we get to whatever point you decide tonight it triggers this requirement, I think it's going to take longer than 2 or 3 days or even a week to truly get things back under control. So that's the reason behind 1 month time frame here.
I like the idea of using the normal attendance as a factor and dropping below that. So our normal attendance, what we would normally see this time of year as opposed to a metric of 90. I also like the idea of using an and, but I prefer the idea of using an or, that it be one or the other. I know there's a lot of passion on idea of like not having masks. I do read all the emails that you send Mr. Siegel. I appreciate them. I can tell you have a lot of passion and you've done a lot of research on this. You and I are opposite ends of the spectrum in our belief or understanding of the situation, what we believe we understand of the situation, and that's perfectly okay too. Speaking only for myself, as a board member, my role is to do whatever I can to maximize and ensure student achievement and make sure that we have an equitable situation for all the kids. So I know that there are kids that hate wearing masks every day. There are kids that are terrified that the people around them are not wearing masks every day. Both are probably irrational to some degree, but they're both also very, very real for both groups of those people. It's real for the parents. There are kids that are immunocompromised and can't get the vaccine. There are people that don't want to get the vaccine. I look at where we're at right now. Covington Independent Schools shut down. They're just closed for 2 days because they don't have an option to do NTI. They don't have, I don't know because they don't have teachers. I don't know the issue. They posted that they were shutting down Thursday and Friday. And part of what they said is to give their teachers a break. I believe what their superintendent said, that they were going to be off for those 2 days because of that. Newport Independent Schools is going on NTI now, and they'll be off until after Martin Luther King Jr. Day, so that's the 18th. So when I think of, and there are other schools who are also similarly entering into these situations right now. So regardless of what we think, mask or no mask, or what the metric is, I fear that's coming. And when I look again at like all students, some students do exceptionally well on NTI, other students do horrible on NTI. Both are real again. And I think that the best situation is if we can keep our kids in the schools for as long as we can keep them in the schools. And what this is all about for me. I think having masking on the students and staff buys us as much time as possible and keeps us in school as long as we possibly could be in school. I think continuing without masks, we're going to get to this situation where we have to do this. So the other thing that this makes me nervous about is, right, wrong, or indifferent, you decided to, and when I said you haven't, Matt, you decided to take that call out of your hands and give it to the board. And the board has spoken and they made the call now about no masks. So you also don't have a mechanism if something goes really bad that allows you to trigger NTI for several weeks, or he was in masks for longer than whatever we decided tonight is masking for a week. You're stuck there because your hands are kind of tied on and giving that power back to us. Correct?
Can I clarify something?
Yeah, absolutely.
I didn't give anything to anybody. A board member requested that be placed on the agenda. And when that happens, it's my, I'm the secretary of the board, but it's my understanding when a board member asks for something to be placed on the agenda, it goes on the agenda.
Okay, I guess probably on the agenda. It's different, but
What have you asked?
I asked to discuss a specific topic. And
Yeah.
you weren't put that on the agenda.
Well, because that falls under the daily operations of the school district, and that's legal, and I've talked to Claire about this, that's legally my decision.
But the health and safety of the students is not legally your decision.
When you call Claire to confirm this, but when I asked Claire about, she and I have talked about this several times. Her statement to me was the masking does fall under the purview of the superintendent because it is daily operation of the school district. However, due to the pandemic, due to the public health aspect of this, if the board chooses to get involved, they can. And the board can, for lack of a better term, overrule the superintendent on this. That's exactly what Claire said to me. So. I just wanted to clarify that.
No, I appreciate the clarification. So again, it's in our hands now, and I would just encourage us, whatever we decide, we need to make sure that this is a metric that's going to be meaningful. And I would encourage us to give some authority to the superintendent to make decisions regarding the health and safety of the children in the school if we get to that point in time. Because again, as Dr. Baker just said, right now he doesn't have that authority.
If you were to need to call a meeting to order, how much notice do we have to have?
24 hours.
So, I agree to the use of a metric just because I feel I'm a give and take kind of person. You know, we're all aware of this, myself, one of this. So, I'm not really in favor of the metric. I can kind of like see it and go, yeah, you know, if we fall below a certain point, when our staff attendance is already at 90, you know, I feel like it's or as soon as the student hits it, we're out because the staff hangs under 90 already. So, you know, we're just missing that one thing. So I would, if it was up to me, I would, A, not put a metric in place, but B, if we're going to do a metric, I would rather see those numbers correlate to being lower than what they're at already. For us to just fall below where we're at normally, you know, for a couple of days, there's a lot of factors that go into that, just like today. You know, with people picking up that are not sending because they fear for their kid being on the bus. You know, I would think that it would need to be lower than where we're at normally. That's my 2 cents. It's just, you know, and I don't know the numbers in head. I haven't really thought that far in advance. You know, I thought before, you know, as soon as it was brought up, what those numbers would look like. But, you know, I would be more changing it. And I agree with you as far as keeping it simple if we do put this in place, as far as if what they missed for. But when you've already got 4 out already, you know, that's already hurting us. So that number would need to be lower on my thoughts.
Can I clarify something here?
Yeah.
I think I just heard David just said, you know, you suggested that I need some latitude to make this decision. And Kyle just said, maybe not really that much in favor of having a metric. When you say that, are you saying, if the board is comfortable with me making this decision, I'm okay with that. You pay me to manage this district. And I'm okay with that. If you want me to make this decision, if you don't want to approve the metric or some variation of it, I'm okay with that. You pay me to do a job, I want to do it. But I'll tell you, here's what I'm going to consider in making that decision, okay? I'm going to consider physically, can we staff our school? Do we have enough people? And it's not been uncommon the last couple of months to have principals, to have central office staff. I've covered a couple classes, okay? We've done that to stay open, to keep the ship afloat. I shouldn't say that. We've done that because it needed to be done. Carrie does an incredible job. She's a professional baseball player, she'd be in the Hall of Fame because her batting average is about 900. But we have some staff out, and everybody knows that, and it's not a local issue, it's a national issue. There's a shortage of substitute teachers. So can we staff our schools is going to be one of my considerations. The other consideration is going to be, what is our average daily attendance? Now, ordinarily, before the pandemic, that would in part be a financial decision, because we are funded on average daily attendance, and if that number drops below a certain point, we're not generating enough revenue to pay the bills, so to speak. But our funding is still based on our ADA from 2019 to 2020. which is a result of legislative action at the beginning of the pandemic. So financially, our ADA right now does not penalize us. However, once it drops below 90%, at that point, I'm gonna look at our dashboard, I'm gonna talk to our nurses, and just make a decision. Some of that is hard data, our dashboard's hard data, some of that's anecdotal data. I'm talking to our nurses, how many kids are you sending home? How much sickness are you seeing? What type of sickness are you seeing? So those are the two data points I wanted to look at. Can we staff our school, and how many kids are out sick, and what type of sickness is it? I will say we have NTI days, and it was actually Senate Bill 25 passed out of committee today unanimously that would give all school districts 10 additional NTI days. Now that has to pass both houses today, it just went out of committee, but I think that's likely to pass. So we could potentially have 10 more NTI days to play with. It would be there for me. I'll put it that way.
So instead of the metric being back in math, we could call it NTI day if needed.
Yeah, you can do that.
Yeah, no, so what I was saying was, I just wouldn't be voting on the metric. I would be,
Okay.
parents are optional. It's the parents' decision to send the kids in mass.
I understand.
We're doing masses.
Okay.
But if I were to agree to a metric, I would be, the numbers would be different than the 90 and the 90 with the staff is already below 90. Like, you know, we're already halfway there.
Yeah.
And a lot of it is
And-
sickness. I think the numbers are.
So that's why I was asking about, you know,
It's-
if we had to vote to go back into mass, it'd take 24 hours for us to vote,
Right.
you know.
Heather, do you have anything on a this meeting? I hope everyone really knows where you stand, what your thoughts are.
Well, about the parameter, I mean, if we're gonna have one, I definitely don't think 90% is where it should be. But I think 90, and I mean, Dr. Baker just said that our ADA isn't reflecting on this school year. However, I mean, we get lower than 90% of, and students missing, what are they really learning at NTI? We're trying, as a board, to keep our kids in school as long as we can. I think dropping past 90% is not ideal, personally. I think 92, 93 maybe, leaning more toward 92. I just think 90% is just getting too low, personally, for me.
Are you for the masks or not? Since we're in
No, we're actually talking about whether I'm for or against masks.
the- I understand that, I was just trying to, I'm just trying to get your opinion of. Where your mind would.
I see both. I see both sides.
Yeah.
I get
think
both
we all
sides. I
saw
get
both
it.
sides too.
People are frustrated with masks, but I also see the science and that masks also work at the same time. I mean, I'll be honest, my kids come sick with COVID. So I'm out of quarantine, but I'm masked up just to stay safe and to keep you all safe.
I love it.
No, yeah, so I mean, I see both sides of it. Since the board voted for it, I stayed with the board because we're a group. So now that we have voted to make masks optional, I think we, as a board, need to come to a consensus about either giving it back to Dr. Baker and letting him decide, which I was fine with to begin with, not even voting on masks, because again, like Dr. Baker said, that's his role, that's part of his job responsibility. But since the board decided to take that and vote on it, I think we need to put something in place or give it back to Dr. Baker to let him make that decision.
One other thing that I wanted to mention, I forgot, was I would like for us to consider option for virtual learning for students, if we're going to continue to be out of masks, I think that needs to be an option.
I have been resistant to that idea thus far. I've spoken to some other superintendents, spoke to Adam Nash yesterday, who is Principal Dixie, spoke in his roundtable about their virtual learning program. And I've asked Adam to get those materials. I've received some materials from another superintendent about their virtual learning program. So I'm very willing to look at that. My thought at this time is, students that are in middle school and high school can be a little bit more independent, and can have success just essentially utilizing a program. However, elementary students need more interaction, need more supervision, they need more prompting, things like that. So my thought at this time, if we want to pursue a virtual learning program, and please understand, we're still looking into this, and this may change, but at this time, I would request a certified position for the elementary and a classified position for the middle and high. The difference is an elementary teacher is certified to teach all subjects. If we put our middle and high school students on a program, then I would have that supervised by a classified employee. If we don't do it that way, and we want to do something more akin to what the elementary is doing, we're going to need to create positions for English, math, science, social studies, and some electives for middle and high. And that quickly is going to run a big tab. But David, I am researching that now, and you may see either a discussion item or a request for positions at the regular meeting later this month. It depends on how much of that I get done. But I am working on that.
I appreciate it.
So it would
because I
be-
look at it, we as a board have created a problem that's created a need, and so it's our duty then as a board to fill that need.
I understand.
So what, when my son was home, he was on synchronous. I mean, is that not an option, that if they want to stay home, they can just do it synchronously through their Chromebooks? How is that? I don't want to, I feel like that would be fairly simple. If they can do it now because they're quarantined, why wouldn't they be able to do it because they choose to?
Let me say, part of my reservation of having a virtual option is we have a lot of high school students kind of take advantage of that situation. We're a hybrid. We had a lot of kids on virtual. We had about 150 high school kids that were on virtual. And you mentioned earlier, you're right, some of those kids on virtual did great. But some of them really didn't do a lot. And they got behind on credits and they're still trying to deal with that. If we have a virtual learning program, it's going to be an application process. And especially for middle and high, you're going to have to make regular progress and complete assignments to stay in the virtual program. It's not
Right, it's not you're just getting out of school.
right.
Yeah.
You can't let that happen. But to answer your question, that's not impossible. Okay, but there's some logistical issues that you create when you say you're going to have synchronous at the high school where kids are changing classes every day. The middle school's doing synchronous right now, but the way they have it designed, you can do it when everybody's on ETI, when all kids are home. They couldn't do it that way if only 5% of the middle school was home. They couldn't do synchronous.
So what are the quarantined middle schoolers and high schoolers doing currently? Because I thought Hunter did his. He got up, got on the computer
Yeah.
when he was in quarantine. He got up and did it, and that was that. So I don't understand. So I guess my question is, how can you do it when you're quarantined, but you can't just choose to do it? I understand middle school and high school might be different, but as far as that's how middle school can do it, and then we have to look at how high school do it. I haven't had one quarantine in high school.
Right now, it's through Google Classroom, it's not synchronous. We go to the high school. What the middle school is doing, let's say I'm a social studies teacher, and and I teach 8th grade social studies all day long. I know that my first period class is my synchronous class. So if you have a student that has me for social studies, and ordinarily that student's in my 3rd period class, they're in my 1st period class when they're synchronous. And what that enables, they have a standard schedule for grades 5, 6, 7, and 8.
Okay.
So that when a student is home, they know that they're in a particular.
They're in that class, not their normal class.
Right. The reason they can do that is because every student has almost an identical schedule. Okay? At the high school, especially for seniors, they're all over the place. Every student has an English class or a math class, and then they're all over the place. So that's what I mean when I say that the way the middle school is doing the synchronous right now, you can do that at the middle school level, but you can't do it that way at the high school level.
Okay.
So I have a couple things. So I just don't know if I agree with the month. I feel like that's a really long time, a month for just a couple days. Because I feel like it's kind of like a bait and switch, where like, we're telling, like, you know, if we're listening to the constituents, and that's what everyone keeps chirping about, is listening to them. There was 2 surveys, and the majority of the surveys said out of masks. They wanted to be optional, they wanted to be whatever. So if we're voting for them, then we're gonna go in and we're gonna be 2 or 3 days down under that percentage. We're gonna go out, we're gonna stand for a month regardless of where the attendance rates come back up to. You see what I'm saying? So I get it, I'm not disagreeing with going back into them. I'm saying, and I'm okay, I just think it needs to be more of a flow. And I understand what you're saying as far as like up and down, I do, but I think the kids, if they understand, like, this is what we're gonna do for a few days to get back out of them, then I think there'll be more, the buy-in from them will be better. And now, so you're telling the parents, we're giving you the right, but then we're gonna take it back. We're gonna take it back for a month, even though after 4 days of being back in, our attendance rates were up here. And they could have stayed there. I mean, you know, it's gonna go up and down, up and down. That's the whole way this virus is. That's the way everything has been with it. I mean, you've got masked people getting it, you've got vaccinated people getting it, you've got the booster shot people doing it. It's not just because of the kids are here unmasked. So I feel like a month is a really long time to make them come back into it, in my opinion. I'm okay with giving it the decision to you. I just feel like a month is a really long time. And we asked everybody, I mean, we asked, a parent did a survey and we did a survey, and the majority have come back, give, you know, optional. And then so we kind of did that. We're kind of going to take it back for a longer period of time if it doesn't hit those marks.
Could I interject?
Sure.
So we did a parent survey, and the results of that parent survey said they wanted to keep kids in masks the majority. It wasn't like 90-10, but it was, I don't remember the number, but it was the majority of the respondents said they did want to keep masks. Is that
But I
correct?
saw opposite.
Let's say the one parent survey was able to be taken by, it was not one and done.
But that's all of our surveys, so
Yeah.
it's not been just this particular survey. All of our surveys have always been like that, and we've never.
I don't know why we would use a tool if we know it's intentionally flawed.
And I think it's,
I don't know either.
Well, I don't know, but if we're doing surveys and people can do multiple times, maybe we need to look into that on another time.
All of those, Google surveys, anyone can take multiple times.
I'm just saying, there should be, I
Right.
know there's places out there that you can only answer
Yeah, if
one
we're
time.
gonna, if we're gonna collect data, it should be good data, and we should believe in that data, or why even, there's no reason to generate data that you're not gonna use or that you don't believe in. I agree with you, Kyle.
So, I mean,
But I just wanted to
my thing
clarify
was before the survey is, if I go to Kroger or I go to basketball, or like I was at Griffin Elite the other day, and there's 1 out of 100 if you see a mask. You know, basketball game, there's 4 people, and 2 of them are the trainers. So it's like the people are telling you without being asked where their thoughts are lying, and that's the way I see it. As far as what I encounter on a daily basis, and not just there, but just everywhere throughout life. I've been monitoring that. What are people doing? And people aren't wearing masks unless they're being forced to by their employer, most of the time.
So I just need to know, are we trying to, we're gonna do the parameters, or are we okay with giving them to Dr. Baker?
I would give that back to Dr. Baker, because I think that, again, we hired a superintendent to lead the district, and I don't think we should pick and choose how he leads the district.
I'm fine with that. I want to clarify something you said is the board created a problem, and we didn't create a problem. We are actively engaged with all stakeholders, and we took a vote, and we all should stand behind that vote as a board member, but we did not create a problem. So I'm fine giving it back to Dr. Baker, but we listened, and we're all actively involved in all of the kids and stakeholders. We all want the same thing, but we didn't create a problem. We just took a vote from a board member bringing up the topic.
Well, I mean, I'm going to say that, I know I'm going to get off subject here for a minute, but it's like you want to give the power back to him and you hired him to do a job, but that just depends on the topic. I mean, like if he wants to call a snow day and you're like, well, the calendar committee did this. I mean, so I know that's not here, but on the email, it's like, did you hire him to do a job or did you not? Or does it just depend on the subject? So, I mean, that's just what I'm seeing.
Yep, I'm glad you
by your
brought that
statement.
up. Glad you brought that up. What I said was, please don't do this, and here's why I believe we shouldn't. And I gave 3 reasons. I did not say, absolutely don't do it. I didn't say, I'm gonna make this an agenda topic that we discuss. I would never even discuss this in public because that was a private email that you just discussed in this meeting. But that's neither here nor there. Again, I just gave some feedback. I didn't say let's vote on it. I didn't say let's discuss
I
it.
think people need to understand how negative you are in every single thing that we do. There is no collaboration, no let's work this out together. You're a very attacking person, and it's awful to sit here and have to work with you.
Thank you for the feedback.
Yeah, I mean, that was my thing, is I'm sorry I didn't bring up the exact parameters. I'm just saying, in general, it's, you're for one time, you're saying, let's give him some power, and in every other situation,
No, if you go back and watch the meeting, I begged us not to vote.
Yeah, and we took a vote.
Leave them with the power. Yeah, I agree.
no, I'm just saying, right, you did on this subject.
I do on every subject. I've never told him what he should do. I've given lots of feedback.
Lots of negative, absolutely nothing positive feedback.
I've given tons of positive
Oh my
feedback
God.
to our superintendent. I don't think we should bring him in the middle of this.
I don't either. You're bringing him into it. You're doing exactly what Kyle said. Picking
No, I
and
agree.
choosing of what topic he gets to decide on.
No, I'll say it again so it's clear for everyone. We elected, we hired.
And we have a community member that goes to the board meeting that brings up a topic that we are all able to
We
vote on.
asked him to do a job, and we are picking and choosing what he's doing for that job. That's
I
what I'm
mean,
saying.
so it was my understanding that it was from the state that it was up to the school board to decide. And my understanding was, as long as we were okay with that, that, you know, we let him make the decisions. But at any time that any of us wanted to bring it to a vote, that we could. So, you know, that wasn't something that, it was not something that we ever, I won't say we ever gave him the power to, I mean, I guess we did, but it was, when's enough's enough, and that was where it was. You know, it's not, we're taking everything away from him. It was always up to us, and, you know, a lot of people voted on it at different points in time, and it's time for us to vote on it. So, and I'm confused on what we're saying by giving the power back to him. Are we discussing parameters, or are we discussing the masks? Because the masks are not on the agenda, correct? So it's just for him to create for him to decide the parameters?
Basically, for Dr. Baker to decide if and when we need to go back to mass. And for how long. That's basically what we're saying, instead of us voting and deciding on this particular parameter that has been given to us. Just let Dr. Baker have that and make that call and make those decisions.
I'm fine with giving it to you. I think you've heard of different opinions about the month and the different things, and it's just something to think about.
I agree with that. Are you?
I heard somebody say that the sign of a good compromise is when everybody leaves the table a little bit frustrated. Not everybody gets everything they want, okay? So I have a recommendation, 90% students and staff for 3 consecutive days, and we go back in masses for a month. I heard a couple board members say that they may have the thought that 90%, that number's too low, needs to be a little bit higher. I've heard it said that a month is too long. Okay? If you decide to do this, that's going to be my guide. 90% for 3 consecutive days. Because I'll tell you, if we're below 90% for 3 consecutive days student attendance, and we're not dealing with a pandemic, it's the flu, and it's the year 2018 before all of this hit. We're below 90% for 3 consecutive days. I'm going to consider, calling off school for a few days. Okay, that's, as far as student attendance is concerned, that's kind of the threshold where you start considering. If you decide to do this, that's going to be my metric.
So where would NTI come into that?
If it's, I will tell you, in talking to some superintendents about using NTI days today and tomorrow, a lot of that was weather related, but some of it was COVID related too. And I think the comment from, I think it was Newport, superintendent said teachers need a break. I'm sure a lot of that is teachers covering classes on planning, things of that nature. It's a staffing issue. So I would consider using some NTI days in lieu of mass, if I thought that would help. Let me give you an example. We're off Monday the 17th for Martin Luther King Jr. Day. If things start getting bad, we start getting close, I would consider 4 NTI days the rest of that week to get everybody out of the building for a week. The problem with that is nobody's staying home. These kids are not staying home. That's the.
Would you ever go back to when we first started, where certain kids went on certain days of the week and then alternating it, so that extra cleaning can happen?
I do not want to go back to hybrid and having
No, I was
30%
just
of our
wondering.
high school on
I was talking about
virtual.
options.
Yeah. At the time, we were doing the best we could with what we had, but, hybrid was good for some things, but overall, I would really prefer not to go back to that.
Would you consider changing your parameters and lowering the staff percentage? But that's the thing is I understand the ADA, like I do, I get that. But then I think about, and I'm going back on my own word here, but you get to a certain percentage, we might not be finding subs.
Yeah.
That's my only concern, but, I also think that we're gonna have people in the building because they don't have to wear them, so.
We were below 90% for 3 consecutive days for staff, December 1st, 2nd, 3rd. The lowest day was that Friday, December 3rd, we were at 83.33%. I think the number that day was 40. Is that correct? We had 40 staff members out. Now it's everybody. It's food service, it's transportation, custodians, teachers, everybody. That was a rough day, I'll tell you. We can't take 3 days today. We just can't. Can we limp by at 88 or 89%? We can, but that's not easy. We can do it to save school. So.
I like to hear that you're open to using NTI days before we go back into them. Just a couple, because like I said, if you use those 4, that's 9 days that people are separated. So that's a long time for it to kind of clear the room.
I mean,
Hopefully we don't have to get to it. That's part of me maybe agreeing to the parameters is going, I'm glad we don't get that low. and we don't have to worry about it, so.
Anything else? So I feel like, the summary of this is, we are going to let Dr. Baker be the one to make the judgment call based on what he sent us with the 90%, including being back in mass for a month. If there's 3 consecutive days of that.
But just to be sure that I have the latitude to use some UTI days if I need to help with that situation. Is everybody okay with that?
I'm more okay.
I'm more okay with it knowing that, you know, we start seeing it slip, especially that time, you know, in between the weather and all that. How many NTI days are
We get
available
10
for?
plus maybe the other 10.
There,
We were given 10, but now we used 1.
Yeah.
Oh, so 2. Oh, yeah, counting tomorrow. Yeah.
so we have 8 left, and then there's a possible additional 10.
Yes. It is, I'll watch that committee hearing today, because it occurred after, if I had made the decision to dismiss early. That passed very quickly at committee, 10-0. It's my impression that that's going to be fast tracked by the legislature. Let me add a very big caveat to that, is anytime you try to predict what the legislature's going to do,
Yeah.
that can be risky, but it's my impression that's going to be fast tracked.
So right now, we'll say we have.
My preference would be that, I don't know if we can just word it a certain way or not, but that it's, that we are giving you the latitude to do what needs to be done to operate the school effectively, be that PPI days, masking for a few days, masking for a few weeks, whatever that looks like, going to the 80-day schedule. I know you said you don't want to do that, but again, give you the latitude to do whatever option you see fit in the toolbox to lead us through this. That's how I look at it.
I'm okay with that.
I'm okay with it.
Typically offlines, but there's such a small amount of us, it's not like it's
Yeah, I
the
think
first
either
and
one of
everybody
them,
else.
if either one of them want to say anything, I'm more than happy to hear what they have to say.
I guess I'm just curious how you quantify the metric after you said that you evaluate sickness as means to measure the metric.
Yeah.
I guess my concern there is that you've got all kinds of false positive cases. How do you really determine that when you use the virus as the means of falling outside?
Yeah. That's what I meant when I talked about part of that decision with risk with our metric, and we do track. I'm guessing you've seen our dashboard. We track deposits, quarantine, student, staff. You know, I would use that data, but some of the data would be anecdotal data. I talk to our nurses every day, and that conversation is essentially always the same. How many kids are you seeing? How many are you sending home? Are you testing kids? If you are testing them, how many are positive, how many are negative? I will tell you that our first day back, our nurses saw a lot of kids, and a lot of them had a fever, and they just sent them home. And at that point, if you have a fever, it doesn't matter if it's a strep,
Right, doesn't matter.
COVID, whatever.
2018, you're going home.
Yeah, you need to go home. So I don't know of those students that went home, how many are COVID positive, how many are not. So I've got to, I'll take the dashboard data, but I've got to take that with a little grain of salt, because I don't know, if we're sending 15 kids home a day from all 3 schools, and over 45 students with fever, then our dashboard numbers don't look great. That's, it's not a good situation. That's going to tell me, okay, I've got to do something here. I've got to make a decision. But if we're sending kids home, or if we're testing a lot of kids as part of test and stay, and those numbers are really low, and our dashboard numbers are low, but we're still sending kids home with fever, it's going to lead me to believe that, okay, there's some sickness there, but it's not COVID. It's strep or flu or sinus infections, what have you. So that's what's hard about this, is I would really like, ideally, I would like a number that tells me what to do. But this is so gray. I hope that answers your question.
It does, which kind of puts more of the spotlight on the concern of the fact that it is gray. And a lot of what I spoke about is that a lot of what we're dealing with is gray.
It's all gray.
It is.
And a comment that Dave, you made is got kids that are terrified of the other kids that aren't wearing masks. That's the core of my message, is that what are we doing with these kids? I mean, if you have a group of students that are adamantly against it for whatever reason, you have a group of students that are terrified against of those that aren't wearing it, cause a big problem with these kids. And that's what needs to be addressed, in my opinion. And I understand that we're dealing with a potential health issue. Again, I would argue against the lack of it. It's serious risk of mental health issues. We're going to be seeing some serious problems in the coming years. Serious problems with these kids exit high school, get into college, potentially have children. You're going to look back and it's going to be a problem. A very serious problem.
Anything else from anybody?
I mean, I'm confused on what we're saying. Because the way it sounds like we're saying is, we're giving the latitude to basically override the vote, is how I understand the wording being said. Is that he can just decide that we go back in to masks.
I don't know that we're saying that. We're saying that we're giving him the latitude if we get to a situation to where we need, in order to keep our kids in our district and school and running, that Dr. Baker, based upon his metrics that he's going to be looking at, what he's going to be using, to then implement, okay, do we have a couple of MTI days, or do we go into mask for a week, or 2 weeks, or a month? We're giving him the latitude to make those decisions and make those calls. That's how I'm taking it.
So if we choose to go back into masks, is that going to be an athletic suit with guests and things?
Yeah, I mean, we're changing to me, it sounded like what we were saying was we're changing what we were doing. Instead of it being cut and dry at 90 and 90.
I would say we're giving him the latitude to do, he's got a number of things in his toolbox. He can use masks, he can use NPI, he can use some creative scheduling if he wants to, whatever, there may be 20 other ideas, but we're giving him the latitude to do what he thinks needs to be done in those situations. Again, my focus is student achievement. So what happens at an athletic event, I may have opinions about that, but again, I don't have to say so in that, and he's back with a latitude, but if he decides no masks are required in an athletic event, and that's what he thinks is right, then that's what he's doing. If he thinks we need to have masks at athletic events for 3 days because our attendance is at a critical point, then he has a latitude to do that. Whatever the event, not just athletic, but art show, music, whatever. Anything we do.
Curriculum, I'm sorry.
I think extracurricular is different than what we're talking now, which is the students in the classroom.
Yeah. To answer your question, Stacy, I would be very hesitant to require masks at athletic events for reasons I've outlined. I don't know, but, and coming to an athletic event is a voluntary thing.
I'm just trying to clarify what
Yeah.
people are going to have.
Yeah, I don't want to put our staff in that position, and I don't want there to be, always think about where could this go? You know, and we've all seen videos of school officials or security trying to, you know, make calls to that one of to wear masks. That I want to avoid that. So I would not require masks in any extracurricular.
So I think it's fair to summarize it to say that, all five of us are giving him the ability to work within the parameters that he is determining, he sees fit to keep the kids in school for their academic achievement, even though each one of us, have different pieces of it that we don't necessarily approve of or like. But I think at the end of the day, when this goes through, I think all five of us, I don't like it's a month. I've said that on camera, I'm saying it again. I don't like it's a month. I think that's way too long once we come back up with the rates. But when we walk out of here and when people email us, I feel like we all have to agree to it. We cannot stand alone and say, I don't agree with that, or I didn't agree with the month. Like, I'm not agreeing with the month, but when someone says something to me, I'm gonna say, it's in his mind, it's in his toolbox, it's in his discretion to do this. Because that's what all five of us are sitting here saying at the end of the day, that we all are agreeing with that.
Yeah, like you brought up before, you know, part of negotiation is, you know, all walk away frustrated, all walk away a little happy, like I asked for us to go out of masks, and then at the last meeting we discussed about having these possible parameters. You know, I mean, and I agree to it, so. Yeah, I mean, I'm not thrilled, but I will agree, and I don't want to see the kids sent back to the NTI, like, long-term. You know, even though you see it going, you know, ultimately, I'd rather have my kids in here having to wear masks, I think, than having them be on NTI. But really, I just think that they're not masking anywhere. Why are we masking them here? But, so yeah, I mean, you gotta give and take. So I feel like I don't think he's gonna make a call tomorrow to go back in masks. To the, you know, I'll agree.
Okay. So is there a second on the motion? Stacy? All in favor of the parameters for the mask requirements? Motion passes 5-0. Next is the motion to elect the board chair for 2022.
I'll make it.
First by David. Are there any nominations?
I would nominate Heather. I've nominated Heather a bunch of times over the years. This is Heather's, I think this is her 8th year on the board, and I don't believe she's ever served as chair. I think she's done a great job as vice chair. Megan, I think you've done a great job as chair over the years. I think it would be wonderful to give Heather an opportunity. I don't know whether she wants it or not, but I would nominate her.
All right, is there any other nominations?
I'll nominate Megan. I think you've done a fine job. You're regional chair, so I think it's fitting if you're able to fill in that role. It's only fitting that you're the chair for us as a group.
Okay. All right, we'll call for the vote for Heather. All in favor?
Aye.
2. All opposed? 3. Motion for myself. All in favor? All opposed?
Aye.
2. Motion passes 3-2. Next is the motion to elect the board vice chair for 2020, or wait, we got it. Is there a second on that motion?
Second.
Sorry. Do we need to remove that? Did I call for a second first? First was David. Okay, all right, just making sure. All right, motion to elect the board vice chair for 2022, is there a first?
I'll make it.
First by Stacy. Is there, any nominations?
I'd like to nominate Kyle. His experience, easy to work with. He's a great community leader and liaison between stakeholders.
Also,
Is there a second, any other nominations? Is there a second on the motion? I'll make it. All Kyle. All opposed?
Aye.
3-2, motion passes 3-2. Next is the motion to elect the board secretary for 2022.
I'll make it.
First by Kyle. This would be Dr. Baker. Do you accept? The thing, is there a second on the motion?
I'll second.
Second by Stacy. All in favor? 4, all opposed?
Aye.
1, motion passes 4-1. Next is the motion to elect the board treasurer for 2022. First by Stacy. Discussions or questions? This will be Hannah.
I'll let you, okay, he accepts.
Okay. Is there a second?
I'll make it.
Second by Kyle. All in favor?
Aye.
Motion passes 5-0. Next is the motion to elect the board attorney to law firm for 2022.
I'll make it.
First by Kyle. Discussions or questions? This would be Dusing.
Yes.
Is there a second? Second by Stacy. All in favor? 3, all opposed?
Aye.
2, motion passes 3-2. Next is the motion to approve the board meeting dates for 2022.
I'll make it.
First by David. Discussions or questions? Is there a second? Second by Stacy. All in favor? Motion passes 5-0. Next is adjournment. First by Heather. Discussions or questions? Is there a second?
I'll make it.
Second by Kyle. All in favor?
Aye.
Motion passes 5-0. We are adjourned at 8:07.